Hi, this is Dr. Paul Inselman from Inselman Coaching with news that you can use. Today we're going to discuss the 5 most common marketing mistakes that practitioners make and how to avoid them. The most common mistake is not knowing your ideal patient. Most doctors go about marketing and they look to bring in anybody and everybody who will come to their office. I think you would agree right now that there are certain patients that you would much prefer taking care of versus others. So the way you fix not knowing your ideal patient is to determine who it is that you like to treat. Are they male? Are they female? What age category? What types of conditions? What's their socioeconomics? On and on and on. So step number 1 is to make sure that you identify who your ideal patient is. Number 2, if you don't know where your ideal patient lives, works, and plays, how can you possibly effectively market to them? Let me give you an example. If I wanted to go fishing for shark and I went in the lake in my backyard, would I catch any shark? Obviously not. Shark do not live in fresh water. So you want to be marketing to the area that's going to give you the highest probability of attracting your ideal patient. Mistake number 3, not knowing about the buying funnel. The buying funnel has been around since the late 1800s. It's how everybody, including you and me, buy all goods and all services. The interesting thing to note about the buying funnel is it is economically sensitive and it is economically derived, meaning that in times of good economies, you should market differently than in times of poor economies. There's a great webinar on my website at inselmancoaching.com that you can watch for free that will give you more information about the buying funnel. The 4th most common mistake is not using strategic-based marketing. Most clients that I come in contact with do what's called tactical-based marketing. In short, that's throw enough garbage up against the wall and hopefully some of it will stick. Do a healthcare class, do a health appreciation day, do a newsletter, do a this, do a that. All good tactics. I'm not saying no. However, when you put those tactics and put strategy behind it, it's like using those tactics on steroids. So it's very, very important to make sure that you're using strategic-based marketing. Not having a cohesive plan. Your marketing plan needs to be cohesive, that your social media intertwines with your healthcare class, which intertwines with your screening, which intertwines with your newsletters. In other words, everything should be cohesive. There should be a plan that you go from A to B to C to D, and it should be done in a fiscally responsive and budgetarily conscious way. At Inselman Coaching, we will help you identify your ideal patient. At Inselman Coaching, we will help you create that cohesive plan based on a UVP, unique value proposition. A UVP is what makes you stand out amongst every other doctor on the entire planet Earth. If you don't have a UVP, it's very, very difficult to market effectively. At Inselman Coaching, we will help you put all of these things together that will give you better profits, more fun in practice, more respect, and the financial security that you deserve. But don't take my word for it. Go ahead and click the link that's flashing on the screen now, and it will take you to the testimonials page. Read for yourself what other doctors just like you had gone through and how their incomes have increased on average 145% since 2008. How would you feel if your income increased 145% since 2008? So I am here to help you. What I'm offering to you is a free, no obligation practice analysis coupled with a free and no obligation consultation. It will allow you the opportunity to find out where the holes are in your practice and to create a plan of action. There is no obligation, and you can do that by clicking the link that is flashing on your screen, or you can go to www.drinselman.com. My name is Dr. Paul Inselman. You've been watching news that you can use from Inselman Coaching. Thank you so much for watching, and have a great day.